Hello, I'm Robert McMullen, MD. I'm a psychiatrist in New York City, and I've been specializing in psychopharmacology for well over 30 years. In the last 9 or 10 years, I've been doing a lot of TMS, transcranial magnetic stimulation. I want to talk about vitamin D today, a very important steroid hormone that is really overlooked. And I'd like to briefly mention, which I'll talk about another time, is NAC, N-acetylcysteine, NAC. And this is an amino acid that allows us to make more antioxidant to clean poisons out of the brain and out of the body. And these free radicals are much higher in depression. And in fact, I was just reading someplace that the glutathione levels are particularly low in the left orbital frontal cortex here on the right side of the brain, which is an area that's specifically treated in order to help depression. And I also like to have very low dose lithium and this NAC, and definitely people on vitamin D during the TMS treatment, because all are involved with helping depression. Now, those of us that talk a lot about vitamin D come to be seen as maybe a little bit crazy about it. If one week I'm talking about vitamin B1 and this is so important, then I say vitamin B6, and then another time it's vitamin B12, and I go on. It sounds nutty. It's just one vitamin and then another. The problem with vitamin D is that it was misnamed in 1922. And once you name something a vitamin, even though the doctor might understand that it's a steroid hormone, just like estrogen and testosterone and cortisol, he or she unconsciously doesn't pay that much attention to it. Now, what's the reason that people from Sweden are really white, and then people from Italy are just a little swarthy and they can tan easily, and then people a little more southern are darker yet, and then around the equator in Australia and southern India and Africa, people are very dark? Why are these huge skin color differences? You know, people just accept it. They just look at it. They say, well, these people are from there. You know, these things don't happen by accident. When I ask people, sometimes they say, well, down near the equator, they need a dark skin to avoid getting a lot of skin cancers, sun-related skin cancers. And this is true. However, even if I were of Swedish origin and lived in Sweden, and I'm actually exactly 1/8 Swedish, it would be preferable, it seems to me, to have a darker skin, because you could get skin cancers in Sweden. So why not have a darker skin? What's the purpose of being whiter anyway? This steroid hormone is made in 5 steps. And the third step, second or third step, needs UVB light from the sun to convert pre-D3 into D3. And then D3 is what we swallow. And all animals except for the African mole rat and the Egyptian fruit bat have vitamin D and use it and need it for various things, usually for the bone development and calcium metabolism and for the immune system. The first animals that used vitamin D were fish that developed an internal skeleton. And when animals came on land, somehow vitamin D became involved with the ability to bring calcium from the gut into the bloodstream because it's got two ions on it, and it's just difficult for the calcium to pass through the fat of the intestine. And somehow vitamin D facilitates this. When humans became upright in Africa, they were hairless apes, basically, or at least they didn't have any fur. And the reason was that they needed to go long distances, walk long and maybe run. And they needed to be able to become cooler during all this heat-producing exercise. And so therefore they developed the ability to sweat a lot. So humans can outrun a deer. American Indians in the plains used to sometimes run down a deer. The deer could not escape into the forest because it was all plains, and a young, healthy Indian could run like a marathon and keep following the deer until the deer was exhausted and then come upon the deer and kill him. So we have this ability to go a long ways fast, and we made huge amounts of D because we had no clothes. The hunter-gatherers that still exist wear virtually nothing. Some of them wear a little bit now out of modesty because of European influence, and they'll wear a loincloth, and sometimes women will put something over their breast, but historically they wore nothing. Now, humans came into Europe about 60,000 years, and then we've only been farming 10,000 or 12,000 years. So the first 50,000 years, humans in Europe were, and also in Northern Asia, the lighter-skinned people from Northern Asia, were hunter-gatherers. They went around in bands of 10 to 50 people and went from one place to the other. Have a camp, stay there for a few months, then move to another. Now, what did they wear in the summer? They had a choice. They could wear leather, fur, or they could spend a lot of time weaving something out of plants. All of these don't sound that comfortable. One of the hunter-gatherer groups I've been reading about recently in Africa traditionally made leather skirts for the girls that they would start to wear when they were 9 or 10, and they would teach them to cross their legs when they're sitting to preserve their privacy, but they would have that, and that was basically the only clothing. And that's probably mainly what hunter-gatherers did in Europe, because it's just why wear clothes and in a warm summer, or they'd wear minimal. So therefore they were making a lot of vitamin D, and you can make about 10,000 units a day if you're really exposed in the summer. And if you want and put your mind to it, you can make 15,000 a day by laying down for half an hour in the full sun in the middle of the day and then turning over for half an hour. Now, much darker skinned people may take 2 or 3 hours to make the same amount. Now, if you are just exposing your arms and your face and maybe part of your legs, you could only make so much vitamin D in any area of the skin once a day. So if you've made the maximum in those areas in an hour or so, then you cannot make any more the next day. So maybe you've only made exposed 1/4 of your body. So you're far from the maximum that you could make. I'm thinking that maybe I should point out some of the differences according to latitude and longitude, or latitude rather, is the further north you are, the more illnesses there are that are autoimmune disorders, and also the more cancers, particularly breast cancer and colon cancer, have been described. These authors in 1981 published this book, Western Diseases, Their Emergence and Prevention by Trowell and Burkitt. Burkitt's the fellow of Burkitt's lymphoma. These were the main two British doctors for East Africa, Kenya, Tanzania, and so on. And they knew everything that was going on in East Africa in medicine, and they supervised and managed all the doctors there. And they saw what a difference there was in illnesses between blacks in Africa and Europeans. And they attributed it, they spent a lot of time thinking it was a different diet and lipids and so on. In medical school, they said, I remember, colon cancer doesn't exist in Africa. Well, actually it does, but it's very rare. And we don't know why. Maybe it's because of the food they eat and so on and so forth. But here's some of the illnesses that they found were extremely rare in sub-Saharan Africa. And all of these end up being autoimmune disorders: thyrotoxicosis, Hashimoto's disease, subacute combined degeneration, Addison's, type 1 diabetes, multiple sclerosis, ulcerative colitis, Crohn's disease, myasthenia gravis, and rheumatoid arthritis, and so on. They're all autoimmune diseases, and vitamin D is intimately involved with regulating the immune system. The reason we have more viruses and flus in the winter is because the population's vitamin D level is a little lower than usual. It's pretty low anyway. Flu epidemics only occur in northern Europe and northern North America. There's never been a flu epidemic around the equator, except for once in a long monsoon season in India, where the sun was blocked for much longer than usual. They had a flu epidemic, meaning the flu sweeps through and it's so bad they have to close the schools. They have the flu around the equator, but one person gets it, another person, it goes around, but it's not very common. And so in addition to vitamin D being important for immunity, it's also somehow involved with the regulation of autoimmunity and preventing us from having our immune system go crazy and start fighting ourselves. About cancer. Vitamin D is involved by at least 3 methods in killing off early cancers. There's many tiny cancers that start in us, but only a few make it through our screening. Vitamin D is involved in this screening, and I recently read a very complicated explanation where there were 5 or 7 different areas where vitamin D was involved in stopping these cancers. If you go to Google and Google maps of distribution of cancer, you'll find that the rate of cancers in general is much higher in all the developed countries in Europe, North America and Canada, South Korea, and Australia. And Australia, despite having all this sun, contains people that mostly live in air conditioning, are very careful about not getting sunburn. They have national advertising that everybody should put on suntan lotion in the morning when they brush their teeth. So they have a high cancer rate. And the lowest cancer rates are in areas of India and Africa and Central America, where large parts of the population still work outside. So what happened is when people moved into Europe, they weren't so healthy because with the dark skin, they couldn't make enough vitamin D to provide all of the health benefits it's necessary for. So they quickly evolved a darker skin, and the further north you go, the lighter the skin. That's why Swedes are so much lighter than Italians, and they don't suntan very easily. Because in Sweden, even in the summer, the sun doesn't go all that high, and it has to be above 45 degrees for enough UV light to get through to make the vitamin D. Some other solid proof about this is that I looked up breast cancer in New Zealand and in Australia. And these epidemiologists showed that breast cancer is twice as common in southern Australia as in the north, and the same in southern New Zealand versus northern New Zealand. Both of these are big countries. New Zealand's a long country. So it's twice as common when they're closer or further from the equator and there's a lot less sunlight. And it's the same is true in the northern hemisphere. Breast cancer is twice as common in northeast United States than it is below Atlanta. And the northeast is worse than the west because factories produce smog-like chemicals in the air that block UVB light, and the prevailing winds go to the east. And the same is true for colon cancer and a number of other cancers. If somebody takes an adequate amount of vitamin D, their risk of colon cancer and breast cancer is reduced about 70%. Very dramatic. Another statistic is that we have 10 times as much colon cancer in the United States as in Africa. Now, blacks in the United States have 50% more colon cancer than whites because they're dark-skinned and it takes them much longer to make vitamin D, so they have even lower levels. So instead of 10 times as much colon cancer, the blacks in the United States have 15 times as much colon cancer as blacks in Africa. So genetically, they're pretty close. But look at the difference in illness rate. It's an enormously important problem. I looked on the breast cancer site, and they did have a little mention of it one time, a couple of years ago, that it looked like vitamin D helped reduce the risk of breast cancer. But they spent all this advertising and raising millions and millions of dollars to do research for treating breast cancer. Michelle Obama should have been talking about vitamin D, not vegetables. Now, what should the dose be? Part of the problem is the FDA has advocated a dose of 400 international units per day for a long time, and now they've gone up and say, well, 800 and maybe 2,000 at the most, and this is all ridiculous. This is a complicated story, but the fact that it's a complicated story shows just how important it is. Mellenby, in 1919, decided to raise some dogs without any vitamin D or without any substance to prevent rickets. So he raised them on oatmeal, which he thought was probably part of the reason Scottish people had so much rickets. And then he was going to give them cod liver oil, which was a folk remedy for rickets. Rickets in the 1800s was so incredibly common. 80% of the children in London had bent bones, either bow-legged or knock-kneed, and it was very high in Boston as well. When Samuel Johnson, who wrote the dictionary, and David Garrick, who had been a student they were both from the same little town. When they came to London to make their fortune, which they did, as they approached the town of London, there was this huge black cloud over the town because everybody heated their houses with coal. And the stories of Sherlock Holmes constantly mentions this deep fog. Well, it was all from that. So people had very little sunlight, and the average working person was 6 to 8 inches shorter than upper class people. You could just walk down the street and tell who was working class and who was upper class just by their height. Some of this was nutrition, but I think a lot of it was because the upper class people in the summer went off to summer homes and visited people in the country and went horseback riding or playing lawn bowls or whatever they did. And they had more adequate D. And it was noted by some people, and even 100 years or more before that, that rickets was not so common out in the country as in the cities. And a couple of guys, I don't know, many decades before this, a couple of doctors had published the idea that maybe sunlight had something to do with this, but they didn't have computer searches back then, so I think people didn't know about those articles 100 years later. So anyway, Mellenby fortunately raised the dogs indoors. He had no idea, but if he'd let them outdoors, they would have made their own vitamin D with the sun hitting their nose and their tongue and maybe the oil on their skin. So they developed rickets, and then they gave them this cod liver oil, a teaspoon, and the rickets got better. So they knew that vitamin A was in rickets, so he said, this is the answer, is that vitamin A is the agent. And when it's low, they just discovered A, B, and C. When it's low, then that's what causes rickets. Now, a fellow named McMullen, who was at Columbia at the time, I think, he'd been at Minnesota and at Johns Hopkins, had discovered, or been one of the major discoverers of vitamin A and B. He knew that you could destroy A by oxygenating it and heating it. And so he did that, and then he gave the cod liver oil to some animals with rickets, and the rickets did not get better. So he knew it was another agent. Since they had A, B, and C, he called it D. So this is vitamin D. See, they just discovered all these vitamins. And that seemed logical. But about 8 years later, a couple of different guys in different places found out that if you put young children with rickets in the sunlight, that their rickets got better. And then they had an ultraviolet light, and they put the ultraviolet light on just one arm of some young boy and exposed him every day, and his rickets got better. This was extremely confusing. Why would sunlight hitting the skin help rickets, and also taking cod liver oil? It took a little while to figure all this out. It's because fish use the same vitamin for their skeleton as we do, and some of their vitamin D is in the liver, not a lot. Most of their vitamin D is stored in their skin, which is why Eskimos get enough vitamin D even though they really can make hardly any, as far north as they are. But they eat fish skin. And then, so the vitamin D was obtained either way, either by taking cod liver oil or making your own. This took a long time to sort out, and by that time, hundreds of articles had been written on vitamin D, and so the name stuck. Now, this is important in depression. It doesn't seem to be the home run that I thought it was, but people with low vitamin D have a higher rate of depression. But that could be just because people that are depressed don't go outside much. However, there are vitamin D receptors in the brain and in every cell in the body, and that means right on the nucleus, the same place there's a receptor for thyroid and estrogen and testosterone, there's a big receptor for vitamin D. and it's supposed to be activated. And in at least one study that compared using vitamin D for treating seasonal depression, winter depression, vitamin D actually worked twice as well as light therapy, where you put up bright lights in front of the person and that sort of mimics spring with a lot of bright light coming in, not UV light. There's also some other evidence. I think one of the reasons it's been difficult to prove this, or why people haven't done it, is because it has a long half-life. So if you weigh 100 pounds, you need 4,000 units a day. And if you start the person on 4,000 units a day, it can take 5 or 6 months before you reach a steady level. So your level is really pretty low the first few months. Studies usually just go 6 weeks or 8 weeks, not 6 months. And hormones can sometimes take a while to have an effect, even if they're at an adequate dose. People should take a loading dose. If they weigh 150 or more, they can take 12 pills of 50,000 international units, 600,000 units, all in one dose. And a study showed that the average level of these people in their 20s was 15, and it went to 71 or so a few days after taking this dose. It sounds like a large dose, but it's only 15 milligrams. And in Canada, they have a shot, a prepared shot for physicians that has 600,000 international units in it. And this is for older people or people that are just not going to take another pill. So then when the doctor sees them, he could just give them a 3-month supply and a shot. And if he's seeing them every 3 months, he's going to keep them on a very good level. The problem with the international units is they were made up in 1922 or so when McMullen figured this out and named it. And they said, well, each teaspoon of cod liver oil will say there's 400 units of this vitamin D in it, because they couldn't measure it or anything. So it was a decade later before they could measure it. And when they measured it, it was a very small amount in it, 10 micrograms of the vitamin D in a teaspoon. So then that translates into 1 milligram being 40,000 international units. So then the doses sound gigantic, and it's a little confusing to figure out what your daily dose is and what your monthly dose is. It's fairly simple if you just say that a 100-pound person needs 4,000 IUs per day, and then you just extrapolate to all other weights. So a 4,000 day dose in a 100-pound person would convert to just 400 units a day for a 10-pound baby, 1/10 as much. And if you weigh 200 pounds, you need about 8,000 a day, and so on. And I find it much easier to have people take a once-a-month dose, and it's much cheaper. If you weigh 125 pounds, you need roughly 5,000 a day. So if you took 3 pills of 150,000, 3 pills of 50,000 equals 150,000 total once a month, that averages out to 5,000 per day. So you just once a month you take that. A bottle of 120 pills costs you $20, and that will last you over 3 years, I believe. That's pretty inexpensive. If you go and buy 5,000 unit pills to take every day, people end up forgetting to take them, or it just costs a lot of money. And one of the most important people in my life was Lou Opler, and he was a PhD psychopharmacologist and MD, who trained at Johns Hopkins. And when we met 10 or 12 years ago, we spent a lot of time talking about vitamin D, and he read all the papers, he understood it, and he even knew the Garland brothers at Johns Hopkins, who first pointed out in a paper in 1980 the possible connection between colon cancer and vitamin D. They said if you look at a map, and everywhere that colon cancer is common is where there's much less sunlight. And he also told me their real name was Garagliano. They were identical twins and very close. And at some point, I guess they changed their name, I guess for professional reasons. But it's true, I saw in the obituary of one of them. Their mother's name was Garagliano. So he knew all about this, and he was taking 50,000 units a week or 4 of them once a month, I forget. And then a year or 2 ago, he called me up, and we talked, weekly. We exchanged emails. We were always discussing cases and medicines, and he was just a very important person for me to learn from and for stimulation. And we shared patients. And he said, I got colon cancer, and I got to go into surgery in 2 or 3 days, but I'm going to fight this and everything else. And I said, Lou, I said, if you're on an adequate level of vitamin D, it reduces the risk of the colon cancer spreading, having metastases. And he said, oh, is that true? And he says, how much should I take? So I gave him some number. So I was pretty diplomatic because I didn't want to say, are you still taking it? So obviously he had forgotten to take it the last few years, and he wasn't on it. So his risk of colon cancer was 70% higher. And then as I said, it's very important during surgery as for your immunity to have a high vitamin D level. And there's surgical literature showing that people with very low vitamin D are less likely to live through the surgery and have a higher morbidity and so on. And during the surgery, he became septic and he died. So I say Lou Opler died because of low vitamin D. And I think the odds are that if he had been on it, he wouldn't have died. Of the 10 or so women patients I've had in the last number of years who had breast cancer, 5 of them didn't take the vitamin D, and even though I begged them, or they were maybe relative of a patient who I knew well, but they still didn't take it. And they all ended up with a total mastectomy and chemotherapy. And the 5 that took it ended up, including my mother, ended up with just a lumpectomy and no chemo or no radiotherapy, or my mother had a little radiotherapy. But it was such a dramatic difference. And then we're not counting the people who never got the breast cancer in the first place. So those of my patients who are taking it, they're not going to thank me when they don't get breast cancer because they're not going to know they missed the bullet. I think you all should really look into this, and it might help if you went to YouTube and watch some videos by Michael Hollick. He found the chemical and the structure of it in about 1972 when he was a PhD student. He's a MD endocrinologist as well, and an extremely intelligent guy that knows all about this. Another important and interesting thing.
What's his name again?
His name is Michael Hollick, H-O-L-I-C-K. And there's another fellow in Britain who's written extensively about it, and just like Hollick is here, and his name is Oliver Gilley. I think Gilley means it's somebody who protects the landlord's property from poaching and so on. And Oliver Gilley was hired to find out why the Scottish people were so much more ill and died younger than the British, even though they were economically the same, and all social classes in Scotland did worse than the same social classes in Britain, and they were the same people genetically and so on. And he did a lot of investigating on this and wrote a book about it. And his conclusion was that it was the low vitamin D, because Scotland is north of England, and the areas that have somewhat more sunlight, I believe Edinburgh, than other areas of Scotland, they have less cloud cover and so on, their health rate was better than other areas of Scotland. The Hebrides Islands are north of Scotland, and they're out in the water, and they have a constant mist go over them, so very little UVB light gets through, and they have the highest rate of multiple sclerosis in the world, which is an autoimmune disorder which is set off by a virus. And as I mentioned before, in East Africa, multiple sclerosis virtually doesn't exist. They said in medical school that you don't get multiple sclerosis if you grow up in South Africa. But if you grow up and move from Germany or England to South Africa after you're 10 or 12 or something like that, then you have the same risk of MS as if you were back in Germany. And they thought that there must be some different virus that's only in the areas of Europe and further north that precipitates MS, and that this virus is not in South Africa. Actually, it doesn't make sense, because all viruses can go everywhere, because the body temperature of humans is the same everywhere. What it was is that because of the altered immune system of people with very low vitamin D levels in the temperate climates, they were more vulnerable to a virus that could set off MS. If they moved to South Africa before they were 2 years old or something, they had virtually no chance of developing this. In fact, they mention that in this. So I don't know who suggested it before, but this 1981 book, they mention that some people have claimed that low vitamin D is causing or allowing multiple sclerosis to happen. And they say, well, that can't be really true, because the Eskimos don't get MS and the Japanese don't get MS. And they're both very far north and have a low amount of sunlight.